अभी आ रही? Hello.
Yes, sir. Good morning, everyone. Divi here from AlwaysLiveYoga. We were having some technical issues, and so we were sorting out that. I welcome everyone and for this beautiful Sunday morning. So today, as you know, we are going to discuss about the PCOD. I'm using the short form, but sir is going to tell you in detail. And we have Dr. B.K.Bandre. He's our advisor of AlwaysLiveYoga, and sir has more than 40 years of experience in yoga therapy, and he's an author also. So, sir, shall we start the session now?
Yes, I am ready.
Yeah, I just request everyone, what we are going to do in today's session, sir is going to explain symptoms and what exactly it is. And we are going to show you the asanas as well. How does it, although we are practicing in our day-to-day regular classes, but still we're going to emphasize those. Apart from that, we are going to take Q&A also. So one by one, after that, once that get over, you can ask your questions. Over to you, sir. Thank you.
Thank you. Okay, so we are discussing about the PCOD, polycystic ovarian syndrome. This problem is faced by modern ladies, young ladies, married, without marriage. They have always this problem, most of them. Some of them are irregular menstrual cycle. There are some symptoms. These symptoms are very obvious. The natural symptoms is also there. Sometimes you will get the information that you are getting menstrual cycle in one or 2 days. 1-2 दिन में आने वाली, उसके पहले कुछ खबर मिलती है आपको कुछ, तो वो तो नेचुरल है. पर पेनफुल रहना, बैकएक होना, क्रैम्प्स एंड हेडेक or depressive feel, irritability, all these gets because of the irregular menstrual cycle. And because of that, you are not healthy for 3 to 5 days in every month. There is a technical problem. People, the gynecologist says that your lifestyle is faulty, or sometimes they say your diet is faulty, but they don't mention correct problems wise. What is the mistake created by the individual? So what happens in PCOD? We will see that. हम देखेंगे पहले कि PCOD होता क्यों, तो उसका क्या प्रोसेस होती है अंदर बॉडी में जिसकी वजह से हमको ये प्रॉब्लम आती है. तो
सर आपका वीडियो डिसअपियर हो गया है somehow. आई थिंक वो बंद हो गया है वीडियो. यस.
तो PCOD में क्या होता है? पॉलीसिस्टिक ओवरियन, ओवरी जो होती है वो एनलार्ज हो जाती है. नॉर्मल साइज है 3.4 सेंटीमीटर, तो वो हो जाती है 12 सेंटीमीटर. इसको बोलते हैं, उसका एनलार्जमेंट हो जाता है और उसके अंदर फंक्शन इरेगुलर हो जाता है, एग्स नहीं बनते. यूट्रस में भी ऐसा होता है, यूट्रस का साइज एबनॉर्मल हो जाता है और कुछ उसके अंदर जो फॉर्मेशन होना चाहिए, एसिडिक फॉर्मेशन ज्यादा होने लगता है, तो स्पर्मस को वो बर्न कर सकता है, प्रेगनेंसी चैलेंज हो गया. ये सब प्रॉब्लम जो है टेक्निकली हमारे को समझने की जरूरत है. तो क्यों होता है ऐसा? व्हाई दिस इज हैपनिंग टू ए पर्सन, अ लेडी हु इज सफरिंग विद PCOD, polycystic ovarian syndrome. So ovaries are enlarged and the uterus is not functioning in full range. The hormones of estrogen and progesterone produced by the uterus is not enough in quantity. Sometimes 3 months, 4 months, there is no menstrual cycle because the estrogen is prominent and progesterone is reduced because of lack of circulation in the uterus. Sometimes prolonged menstrual cycle is continued because of excessive production of estrogen, progesterone. This is called irregular cycle. 5 days, about more than 5 days, you are facing the menstrual cycle and trouble associated with the menstrual cycle. ये सब चीजें irregularity में आती है. हमारी महिला जो शादीशुदा है उनको भी ये प्रॉब्लम फेस होती है। तो उसमें वो उनका एनलार्जमेंट होने से, ओवरीज में एनलार्जमेंट होने से एग्स नहीं बनते, तो स्पर्मोज के साथ में फ्यूजन नहीं होकर प्रेगनेंसी नहीं होती। फिर आईवीएफ के लिए जाना पड़ता है। तो ये सब चीजें होने का कारण गायनेकोलॉजिस्ट बोलते हैं कि आप खाना ठीक से लो, एक्सरसाइज करो, और लाइफस्टाइल में स्ट्रेसफुल नहीं रहना, ये सब दे जस्ट सजेस्ट यू, but the basic cause is not been enlightened by them to the patient. What is basic cause? That I will explain. The basic cause, although your uterus and ovaries are healthy, but the circulation toward the organs is poor. Therefore, this irregularities develops in the individual. So what is the irregularity? You see, these organs get blood supply from L4, L5 of the spine, where you get pain initially when you get the alarm of menstrual cycle. So L4, L5 is compressed in case of your sitting job, or if you sleep or left side on more time, because your uterus and ovaries are hanging on the left side, and the circulation is due to your weight is compressed. People say weight is the cause. No, weight is not the cause, but the weight may increase your problem. So when you sleep on left side all the time, most of the time, and you feel happy and get induction of sleep very quickly, बाई करोड़ में सोने की आदत पड़ गई हो, या एक बच्चा होने के बाद बच्चों को प्रेगनेंसी के दरमियान बाएं करोड़ में सो के डेवलपमेंट किया आपने, वो आदत पड़ गई, बाद में पीसीओडी हो जाता है। तो बाई करोड़ में सोना एक कारण होता है, और दूसरा कारण होता है यूट्रस को और ओवरीज को ब्लड जमा होने का और सूजन आ जाना, उसमें इन्फ्लेमेशन होना, उसके ब्लड रुकने का कारण होता है पेट के बल सोना। कई महिलाओं को बचपन से ही बोलो या 12-13 साल की उम्र से, when they are in puberty, they are habitual to sleep on belly. They feel happy with sleeping on belly because of their habits. On sometimes there may be some other process of thinking. तो उल्टा सोते हैं, तो उल्टा सोकर फिर पेट दबता है, तो एक पैर को मोड़ लेते घुटने को पेट की तरफ, और दोनों पैर मोड़ के भी सोते हैं कई बार। तो इस तरह से जब घुटने मोड़ते हैं तो प्रेशर आपकी यूट्रस और ओवरीज की नर्व पे ज्यादा पड़ता है, एडवर्स प्रेशर रिजल्ट्स इनटू ब्लड clotting in the uterus and ovaries. Blood clot increases the size of ovaries and uterus, and their function is irregular. This is the basic lifestyle change problem. Who has not yet, anybody gynecologist not explained you about this. If you are suffering with PCOD and visiting to your gynac will say, okay, do exercise or reduce weight. This is like eat proper food, like that. But they don't say that you should not sleep on the left side or on the belly. That they are not aware about their lives, because in their gynac book the posture of sleeping is not mentioned. Posture of sleeping myself I have developed the study, the research done, and I found hundreds of females are suffering with PCOD because of their posture of sleeping in night. Why it is so effective? Because the hormones production takes place in the night, not more in the day. Night time. The normal healthy women required to develop their hormones in a proper quantity, estrogen and progesterone, for better cycle and regular cycle, and without any symptom or very minimum symptoms, without any disturbing their routine, job or their housework or whatever they are assignment, without disturbing that, they should be carry out their daily lifestyle. This problem is faced. So I have done the research on about 25 women, 30 women, those who are suffering from age of 18 to 30 in between. I found that they are very much corrected their system. Sleeping posture is corrected. Ask them to correct and given some yoga, which you will just see on screen just after my talk. What are the positions which improve the circulation from L4, L5 vertebra of lumbar to the uterus? And the cause should be avoided. Only yoga is not helping. Many women are doing yoga, but they are facing PCOD. They are facing PCOD. Yet they are doing exercise, aerobics, all kinds of exercise they are doing. But the night time they are creating mistake to sleep in the position. Don't get addict with left side and on belly. So you will be improving your circulation to the organs, and the function of the organs will be in proper way. No panic condition will be created. So this is my found in my 25 subject. They all improved, and some of them were waiting to get pregnancy. So I asked them to continue with these yoga practices, and the muscle power of the back will increase as well as the hips, and then the delivery will be normal. So I asked them to continue these practices till the pregnancy and delivery. So this is what I have carried out in my research, and I found that 78% result was in favor of my research. 2-3 ladies were not improved because of they were unable to control their postures in sleep, and some of them had dropped down the practices also, what I recommended practices. So it is very clear that this mistake should be checked and yoga practices should be carried out. So I request Devi madam to display the practices of yoga. Then we'll go for
Sure.
question answer session. Let us, can you show these practices? These yogic asanas helpful to improve the circulation toward the uterus and ovaries, and the size will be managed to normal. Now let us see that. The first practice is Talasana. Very simple, very easy to practice. Just raise your hands and heels and stand on the toes as much as you can. Extended body with deep breathing. With deep breathing 10 times. You have to deep breathe in the position, particularly in this Talasana. He is doing Talasana. This is nothing but the extension of the lower back. Talasana. Then next practice, this can be repeated 2-3 times. Tadasana. 10 breaths you should maintain in the position. Then next practice will be Kati Chakra. So this Tadasana is one practice, very important at the starting. Next practice is Kati Chakra. Kati, legs apart by 1.5 feet, and then twist your spine with your hands and head to the one side to another. Regularly, 5 reps on both sides will be good enough. This total practices will require about 30 minutes maximum. But here in video, we'll finish with about 7 to 8. This is a second practice which improve the circulation in the uterus and ovaries with the lower back movements in the circular angle. Now the third angle is lateral angle. The back should be mobilized in the 4 directions. We have the 4 angles to improve the circulation. This is a third angle. First angle extensively against gravitation. Second was rotative. Third was lateral bending, which also improve the circulation in the organs. And this is to be practiced twice, thrice. By resting in the position, you have to breathe 10 times normally. That is the duration of pose to stay in the pose. Trikonasana. This is a Trikonasana.
So, sorry, these ads are going on.
No, you can switch off that. You can remove that. There is an option. Then the third practice is forward-backward bending. What do we call it? Padhastasana. Hastapadasana. Some people say Padhastasana. This is a forward-backward bend angle, very important angle for improving the circulation to the organs, ovaries and uterus. This has to be repeated 5 reps, going backward and going forward. This is therapy. You don't need to stay in the pose. Go on doing repeatedly. So circulation improves. These are the 4 practices in standing. The 5th practice will be cat back pose, Marjorie asana. 2 feet away your hands from the knees and then move your neck up and down. Here the lumbar region is mobilized up and down, up and down. Very simple, very effective. This is called cat pose, Marjorie asana in Sanskrit. Marjorie asana. This also take care of your feeling, the bad feeling, or you can say headache, migraine during the period menstrual cycle will be checked by this practice. This is a neck movement is helpful to improve the circulation in the head, and therefore headache, depressive feeling, anxiety, or irritability will be minimized. Even insomnia will be taken care of. This continuous neck movement is very helpful. Next practice is Bhujangasana, Cobra. Very simple practice, thrice a day, thrice you have to repeat, and every time you have to stay in the pose for 10 breaths. Slight retention in the pose is good to improve the circulation in the lower back and the lower abdomen. Bhujangasana. Bhujangasana. 3 reps. Every reps will be carried out by that breath normally. Bhujangasana will take care of the belly size and the double chin and the lower abdomen. This Ardha Shalvasana. Very important practice to improve the circulation in the ovaries and uterus and reduce this compression on the L4, L5, lumbar vertebrae. This you have to repeat 3 times alternately, 1 leg only. Not 2 legs. 1 leg is more important, raising from the ground toward the maximum upward direction as much. Now, after this, you have to turn on the back and just 3 practices are more left. One is Ardha Shalvasana. This is Ekpad Utthhitasana. 90 degree you have to raise if possible without bending the knee. And toes will be pulled towards the head side. पंजों को अपने पैर के पंजों को अपने सिर की तरफ खींच के रखना और पैर उठाना है 90 डिग्री पर. इससे आपका हिप जॉइंट के अंदर से जो वेन्स स्टार्ट होती है, आर्टरीज टुवर्ड द यूट्रस विल बी इंप्रूविंग इट्स सर्कुलेशन. ये 3 बार करना होता है. एक पैर एक पाद उत्थितासन बोलते. यही प्रैक्टिसेस मैंने अपने रिसर्च में अडेप्ट की थी और इससे बहुत अच्छे रिजल्ट आए. और सिंपल प्रैक्टिस है, इजी टू है. मिनिमम टाइम इज 30 मिनट्स, मैक्सिमम टाइम इज 35-40. Depends on your understanding. Then more 1 or 2 practices are left there. One is Ekpad Mukdalasana. In the same position, lying down and raise 1 leg and rotate it clockwise and anti-clockwise direction. If you rotate them, your leg without bending your knee, that will be the next practice. And one leg clockwise and an anti-clock. Similarly, the other leg. After that, you have to pull your both the knees toward the chest side and repeat Pavan Muktasana after Mugdalasana. Then Pavan Muktasan means two knees together, bending and holding it toward the chest side.
Your
and
voice
releasing
is audible, sir.
Five times.
Ma'am, it is audible to me. Any other are also facing the same issue? Sir is not audible. Please give me thumbs up if sir is audible or not.
Sir is audible.
Now
Okay.
it is audible, ma'am.
Yeah.
So next practice and the last but one practice in the very important for lumbar region to improve the circulation is Setu Bandha. After this Pavan Muktasan, what we are doing, keeping the legs too close towards the hip side and raising the hips up and down, repeatedly 10 times. That is called Setu Bandha. And that is not a constant practice, repetition. Hips raising up and down. And the last practice is pelvic tilt, because pelvic region required to improve the circulation. So the last practice, hands will be toward the head side. I think that video is not continued, so I am explaining you the 3-4 practices, which is to be practiced on the back, supine position. And that pelvic tilt is just keep legs apart by 1.5 feet, tilt your both the knees to one side and face to other side, and hand will be like toward the head side. So both sides you have to repeat 10 times. That's all. And Shavasana. 2 minutes to 5 minutes Shavasana. That finished the course or practices, which is very key practices to improve the problem. The problem will be solved. If you are suffering chronically, then it requires about 3 months to correct total cycle. First month you will be improving by 30%. In 1 month with this practice. And second month, about 65% your problem will be solved. And third month, total problem will be solved, no pain, your irregularities will not be there, and your menstrual cycle will be in your control for 3 days, not prolonging more. And all side of symptoms, all kinds of symptoms will be controlled, which I discussed you in early period of my talk. So I hope you got practical idea about the problem and my research, which is very, very popular. And those who have done twice IVF, they also practice yoga and got the pregnancy in after 3 months. So hopefully I have discussed the length of my research, and I think you will enjoy with your question now. Any question regarding
Your,
my
video is not visible, sir. Again, I think it stopped. Okay.
is
Yes,
there any
fine.
is there any question required to ask by you? You are welcome. You can.
Sir, good morning, first of all, sir.
Anamika.
Sir, yes, sir. Sir, I'm facing this problem. I think it's been 10, 11 years now. PCOD. It is a part of my life now. I'm on medications, but once I've started this yoga, AlwaysLiveYoga, so I'm not taking any medicine. So, waiting
How do you
for.
feel?
That's wonderful, ma'am. You have reported something
I'm
good to us today.
You're happy?
Okay, ma'am. Actually, I think it.
Medicine may be helpful. Medicine may be helpful, but it is not curable. Medicine won't cure you. It helps you. But my yoga practices will
true,
cure.
sir, because yes, sir. Yes, that is what I'm hoping now, because I'm thinking that I'll be for at least for an year. So waiting for some good results to happen, because I think 3 years I'm on medicines, or now firstly I used to take Dronis 30 and then 20 for 2 years, and now my doctor has put me on Q Life. So, and I'm
Okay.
facing so much anxiety and all, but I think अभी बीच में मुझे टाइफाइड हो गया था, तो मैं अटेंड नहीं कर पाई, मैम को पता है, बट एंजाइटी और जो स्ट्रेस वगैरह वो काफी मेरे को योगा से कंट्रोल हुआ है, meditation से भी सर. But now I'm going to practice these poses which you have told me on regular basis.
Okay. Anybody else?
Anyone have a questions? You can ask this video which we have shown. अभी हमने जो वीडियो दिखाया है ये हमारी वेबसाइट पे भी अवेलेबल है और यूट्यूब पे भी आप इस वीडियो को देख सकते हो. तो ये अवेलेबल है, इसमें सारी प्रैक्टिस सर ने बताई हैं. हाँ वही मैं सर बता रही हूँ. हाँ यूट्यूब पे भी है और वेबसाइट पे भी है, तो आप किसी पे भी ये सारी प्रैक्टिसेस जो है देख सकते हैं. ऑल्दो हम ये क्लासेस पे करते हैं, बट डेफिनेटली रिपीटेशन जो है वो इतना नहीं है, या फिर हम उनको अल्टरनेटिवली कर रहे हैं अल्टरनेट डेज पे या कुछ. बट मोस्ट ऑफ द प्रैक्टिस जो आज सर ने दिखाई है वो आई एम श्योर हम डेली क्लासेस में कर रहे हैं, क्योंकि मैं भी वही क्लासेस अटेंड कर रही हूँ जो आप लोग करते हैं, और मैं ये सारी प्रैक्टिसेस कर रही हूँ. I think there is a question with Archie ma'am. Archie ma'am, please unmute yourself.
Yes, sir.
And ask it.
यस मैम.
Yes.
मैम मुझे भी सर, मैंने थोड़ा सा लेट अटेंड किया था ये सेशन, तो सर ने अभी बात की ना स्लीपिंग पोस्चर की, तो मतलब आप कोई वीडियो अवेलेबल है उसका?
हाँ ये जो वीडियो हमने दिखाया है वो भी है, और आज की जो हमारी रिकॉर्डिंग होगी, ये जो सेशन किया इसकी भी रिकॉर्डिंग यूट्यूब पे आपको मिल जाएगी.
हाँ.
तो अगर आपका थोड़ा सा सेशन मिस हो गया है तो वो आप वहाँ देख
वो
सकते
साइड पे
हैं.
मिल जाएगी, साइड पे डाल देना आप रिकॉर्डिंग.
हाँ जी सर, जी सर.
ओके, किस नाम से ये ऑलवेज लाइव योगा की यूट्यूब चैनल?
यस यस, यूट्यूब चैनल पे आप सब्सक्राइब कर लीजिएगा. आपको वहाँ पर ये आज का जो सेशन है वहाँ हम अपलोड करेंगे कल तक, आप देख लीजिएगा. और बाकी सर ने जो बताया वो पोस्चर का बताया कि हम एक साइड सोते हैं, उसकी वजह से हमारे ओवरीज में, हमारे यूट्रस में ब्लड सर्कुलेशन नहीं होता है, क्योंकि हम एक साइड से 2-3 घंटे 3 घंटे सो जाते हैं रात में स्पेसिफिकली. तो वो सर ने उसको ज्यादा एम्फसाइज किया.
कई लोगों को तो बिना
जी सर बिल्कुल, मैं खुद सोती थी और आपके कहने के बाद मैंने वो चेंज किया है अपनी हैबिट.
ओके, थैंक यू मैम. थैंक यू सर.
थैंक यू.
सर मुझे प्रॉब्लम है.
यस यस मैम प्लीज.
सर मुझे भी पीसीओडी की प्रॉब्लम है. कब?
हाँ आपको पीसीओडी की प्रॉब्लम है
सर कभी आते कभी नहीं, ठीक हो जाते हैं.
आप ये योगा जो बताया वो करो आप, तो ठीक हो जाएगा. और हार्ड बेड पे सो, और पेट के बल नहीं सोना, पेट के बल उल्टा, और बाई करवट में ज्यादा एडिक्ट नहीं होना चाहिए. सो सकते थोड़ा बहुत, ऐसा नहीं कि बिल्कुल प्रिवेंटिव है, पर जिनको पीसीओडी उनको थोड़ा प्रिवेंट करना पड़ेगा. और जिनको नॉर्मल है उनके लिए तो कोई प्रॉब्लम नहीं है, पर जिनकी जो प्रॉब्लम फेस करते हैं उनको ये रिस्ट्रिक्शन तो रहेंगे. ठीक है?
ठीक है सर. थैंक यू सर.
वेलकम. और कोई दूसरा, किसी को और कोई?
I think Vinisha ma'am want to ask because she unmute herself and she wants to. Vinisha ma'am, you want to ask some question to sir?
Manisha is okay.
Sir, is depression and anxiety is symptoms of PCOD?
मेरे को क्लियर नहीं हुआ, एक बार फिर पूछे.
सर वो ये कह रही है कि सिम्टम्स ऑफ एंजाइटी जो है वो पीसीओडी का सिम्टम है क्या? अगर किसी को डिप्रेशन और एंजाइटी है
वो
तो
बढ़ेगा.
क्या वो पीसीओडी का सिम्टम है?
पीसीओडी विल ऐड ऑलवेज, क्योंकि वो हार्मोन इवोल्यूशन जब शुरू होता है, वंस यू गेट दी, इफ यू हैव एंजाइटी प्रॉब्लम और इंसोम्निया और हेडेक और माइग्रेन और डिप्रेशन, so these can be aggravated during that period, menstrual cycle, because the addiction हो जाता है उससे. दोनों मिलके, यानी दो दुश्मन होते हैं आपके फिर उस टाइम. एक तो आपका इरेगुलर मेंस्ट्रुअल साइकिल रहती है, वो दुश्मन ही जो तकलीफ दे रहा है आपको, और दूसरा क्या होता है जो आपका कोई इनहेरेंट रहता है, जैसे आपको बैकएक का प्रॉब्लम है, उन दिनों में बढ़ जाएगा, सिर दर्द है वो बढ़ जाएगा, गुस्सा बढ़ जाएगा, नींद कम हो जाएगी या बहुत बढ़ जाएगी. बच्चों को डांट फटकार ज्यादा पड़ेगी, हस्बैंड को भी एक आध थप्पड़ लगा सकते हो आप। क्योंकि उस टाइम बहुत इरिटेबिलिटी रहती है, तो क्या कर सकते हैं। दैट इज बिकॉज ऑफ हार्मोन। हार्मोन्स आर डेंजरस, वो बहुत खतरनाक होते हैं हार्मोन। यानी किसी आदमी को मालूम पड़ा कि मैं किसी महिला को छेड़ूंगा तो मेरे को जेल जाना पड़ेगा, पर फिर भी क्यों छेड़ता है? क्योंकि उसके हार्मोन्स, सेक्स हार्मोन बहुत एलिवेटेड होते हैं, वो उसको प्रयास करता है उसको डेवलप करने के लिए और ज्यादा। तो इस तरह से फिर वो जेल जाने को तैयार है, पर छेड़े बिना नहीं रहेगा। ये इतना खतरनाक होते हैं। तो जब ये इवोल्यूशन होता है मेंस्ट्रुअल साइकिल का, उस टाइम आपके बॉडी में यदि कुछ प्रॉब्लम रहा, जैसा बैकेक की प्रॉब्लम है, पर पीरियड का टाइम वो एग्रीड डबल हो जाए, ऐसे सभी प्रॉब्लम बढ़ेंगे, एंजाइटी बढ़ेगी, क्रोध बढ़ेगा वो अगर। तो ये उसके डायरेक्ट पीसीओडी का साइड इफेक्ट नहीं है, पीसीओडी एग्रीवेटिंग फैक्टर है। तो आपको वो दो पीसीओडी भी कंट्रोल कर लिया आपने, तो आपका एंजाइटी भी कंट्रोल में रहेगा, नींद भी अच्छी आएगी, प्रेम भाव भी बढ़ेगा, गुस्सा कम हो जाएगा। वो हार्मोन्स को हमको करेक्ट करने की जरूरत है, एस्ट्रोजन और प्रोजेस्टेरोन बस। और ओवरीज में जो है नॉर्मल फ्लो ब्लड का रहता है, तो ओवरीज कोई प्रॉब्लम नहीं करती। ठीक है मोनिशा?
Thank you, sir.
So it was
Any other
interesting
questions?
topic. कोई question?
Otherwise we will end the session today. और बाकी अगर आपके वैसे भी कोई क्वेश्चन हो तो आप हमें व्हाट्सएप कर दिया कीजिए, एंड वी विल आंसर दोस क्वेरीज, व्हाटएवर क्वेश्चंस यू हैव।
साइट पे डाल दो, साइट अपनी जो है
सर।
alwaysliveyoga.com पे डालो
यस
आप।
सर, नहीं साइट पे तो सर हमने ऐसे कोई ऑप्शन नहीं दिया हुआ है, बट हाँ डेफिनेटली दे कैन राइट टू अस ऑन आवर व्हाट्सएप नंबर, उन सभी के
नहीं,
पास है। सो
आप उसको ओपन करो, उनके सजेशंस हो, प्रश्न हो, कोई प्रॉब्लम्स हो, वी कैन डिस्कस।
श्योर सर, श्योर सर, श्योर सर। Okay, everyone, have a nice day. Happy Sunday. Thank you so much, sir, for joining us today. Thank you. Thank you,
ma'am. Thank you,
everyone.
sir.
Thank you, ma'am.
Thank you.
Thank you so